Yes, I'm here.
Okay,
And the
good.
meeting is recording now.
Okay, great. So we're, I really appreciate this. We are recording it so that for those who couldn't join us, we'll be able to share the recording. Our American Cancer Society has been doing a lot to support people, cancer patients and people on the front lines. And so I've invited some of our coworkers, our executive director, Kelly Moran, to share a little bit about that. And then Eric Hadern is our grassroots manager for our Cancer Action Network. And so he is really great at explaining the work that they do, and he's really going to focus on what CAN has done and is doing to support the American Cancer Society and cancer patients. And so I think the presentation is going to be really beneficial for everyone, and I'm just really thankful to have them here with us. So the call is going to start with Kelly, and then Eric will share CAN, and then I'll kind of review some of the resources that Kelly covers in a little bit more depth. We'll cover some of the work that we've done with the Colorado Cancer Coalition, and then we'll kind of open it up for Q&A. Bill has been monitoring the chat box for us, so he'll continue to do that. If there's a question that comes up during the presentation that makes sense to ask, he'll ask it then. Otherwise, we'll likely hold it till the end of our presentation. And yeah, so I think we'll start. Kelly, if you want to start with, and we can move to slide 2. I really appreciate having you here. Maybe as an introduction, you can kind of just share a little bit about your history and why you decided to start working for the American Cancer Society.
Oh, sure, Jen. Thanks. Happy to. So hi, everyone. As Jen shared, my name's Kelly, and I'm the executive director for the Rocky Mountain area with ACS. And I have been a staff member here for about 7 months, so still pretty new. And I have to say, I'm just so thrilled to be a part of this organization. Um, and I was thinking about it today as I was, getting the week started and getting our at-home learning going with our kids. It's just, I can't think of a better way to start the week than talking to all of you. And I, just know that the work you guys do is so incredible and gives us all so much pride and energy. And so I'm really happy to be here with you today. So I have spent about 15 years working with large health-focused nonprofits, national health nonprofits. And I had actually had the opportunity to go live abroad for a year with my husband and our kids. And so when I returned, I really feel like this job found me. Um, I have lived, in my immediate family, we've had the experience of living with a chronic disease. And so I know firsthand, how that impacts families and friends and loved ones, and how important it is to be able to fight back in a way. And that, organizations like the American Cancer Society are where we can all come together and kind of organize ourselves and, join our voices and become stronger, and just how much of an impact that's had on my life. And so I'm really passionate about helping others, do that same thing and, get some of that power back to be able to fight against really challenging diseases. So Jen asked me to talk with you guys today, about some of our ongoing services for people with cancer through this pandemic. I mean, everyone on the everyone on the phone, knows how impactful this has been. And so, ACS has really had to adjust our operations quickly to be able to respond to this. And there's been some really challenging decisions that we've had to make, but all of that has been with our guiding principle of putting the health of the people we serve first, no matter what. And so, pushing pause on things like the transportation program was heartbreaking for this organization. But, with that decision-making framework of putting the health of the people we serve first, we knew it was what we need to do. You know, I talked to you today. I think probably like many of you in your jobs, we've turned into a virtual workforce over the last 5 weeks. You know, all of our ACS offices are closed. And so we've been connecting in new and different ways. And, you know, I have been really inspired by the amount of creativity and energy that I've seen come out of everyone during this time. So we know that it's going to be a difficult fundraising year for the American Cancer Society and really for all nonprofits. But, everyone here, I know all the volunteers and the staff on the call are incredibly committed to supporting people with cancer through this time because cancer doesn't stop even when there's a pandemic, and so we can't either. So I want to just talk to you today about, kind of how that looks for the organization right now. So in 2020, there will be an estimated 1,806,000 new cancer cases and 606,000 deaths. And in Colorado, that's an estimated 27,000 new cancer cases and 8,000 deaths. And approximately 80 of these cases will be diagnosed in people 55 years of age or older, which is that age piece also aligns with some of the high risk groups for the COVID-19 pandemic. And as these cancer patients and their loved ones face the many challenges associated with the diagnosis during these times, the American Cancer Society is here to help with evidence-based cancer information, resource referral, navigation, and support. And when you go through a cancer diagnosis, many people become overwhelmed by the number of appointments, the amount of information, the cost, the logistics, and the stress of cancer, in what is already a stressful time. And these challenges are especially pronounced for the medically underserved populations. So like, for example, low-income individuals, people living in rural areas where they may have reduced physical access to care, or people with a low medical literacy, if you will, or language barriers. And so now patients must navigate the new and challenging landscape of accessing cancer treatment while at high risk for a life-threatening COVID-19 infection. So as this pandemic has continued to worsen, the Society has taken into account the recommendations for the Center of Disease Control and Prevention, and made the very difficult and heartbreaking decision to suspend our Hope Lodge and transportation programs nationwide until further notice. So this includes 33 Hope Lodges in 26 different states nationwide that offer cancer patients and their caregivers a free place to stay when their best hope for effective treatment may be in another city. I just want to check in real fast and make sure everyone can still hear me. I just had an odd beep.
We can still hear you, Kelly.
Okay, perfect. Thank you, Bill. So when we took this action to suspend our Hope Lodge program, we worked with our guests to find other resources. So that included our alternate lodging, or maybe it was assistance in getting back home. And when this program reopens and hospitals return to normal operations and patients resume their previous schedules, we do anticipate the need for lodging and transportation programs to be greater than ever. One of the things we're seeing is that people's treatment, may have been delayed or something like that because, hospitals are really focusing on how do we keep people safe? Does this need to happen right now? And does it make sense to have this person in the hospital? So despite having to temporarily suspend 2 of our signature programs, we recognize the very critical ways that we can continue to help cancer patients through the unprecedented challenges we face. So across the country, cancer patients are experiencing unique clinical, social, and financial disadvantages related to the COVID-19 pandemic, and it's essential that we quickly adapt to answer their most pressing questions, provide evidence-based information and up-to-date resource referrals, and just do everything possible to protect the health and well-being of them during this time. So one of the things we're all very proud of is that we are leveraging our Hope Lodge facilities nationwide to support the coronavirus response. We've actually our hospital system partners, we're working with them where we have Hope Lodges and offering them free of charge for them to use these Hope Lodges to house essential workers who maybe are recovering from COVID-19 themselves and trying to get back in the hospital, or cannot go home at this time because of family members or loved ones who may be in the high risk group. Many different factors, but we're here partnering with them, with the Hope Lodges, to make sure that they have a place to stay. And we see that it is really been well received by them, and we feel like strengthening what is already a very strong relationship with our hospital partners, all in an effort to get through this pandemic, and try and support everyone we can while we're doing it, and get people fighting cancer back in the Hope Lodges as quickly as possible. So thank you so much to all of you, and with that, I'm going to pass it over to Eric.
Thanks, Kelly. I'm Eric Hadorn. I'm the grassroots manager for the American Cancer Society Cancer Action Network. I work throughout the state of Colorado to teach folks like all of you on the call to use your cancer stories to talk directly to your elected officials and pass policy and legislation important to the cancer community. Since the beginning of this pandemic, the American Cancer Society Cancer Action Network, or ACSCAN, has been extremely busy working to ensure all of the federal relief packages kept a cancer lens and helped folks in need. So far, the federal government has passed 3 relief packages to address the pandemic, and I'm just going to go through a little bit about what those packages mean for us and for cancer patients, and then I'll talk a little bit about what's happening in Colorado specifically. Access to care provisions that will benefit patients during the COVID-19 crisis and may specifically benefit cancer patients who are at a particularly high risk include no-cost COVID-19 testing for insured and uninsured individuals, increased funding for state Medicaid programs to ensure access to low-income and recently unemployed individuals. Medicare patients can receive a 90-day supply of medications rather than a 30-day supply. It increased funding for supportive services like nutrition support for seniors, and expanded access to telehealth and in-home care for Medicare beneficiaries and veterans using the VA health system. With regard to health system, these bills added funding to support hospital capacity and cover healthcare providers' COVID-19 related expenses, gave funding to support federal, state, local, and tribal public health agencies as they prepare for and respond to the COVID-19 crisis. It extended community health center funding through November 30th, 2020, with additional funds to purchase medical supplies and drugs for the pandemic response. And then as research and regulators are concerned, the pieces of legislation increased funding to the NIH to research and develop COVID-19 diagnostic tools, vaccines, and therapies. That increase actually happened twice in 2 different bills. It also gives funding to help the FDA review and authorize medical devices, vaccines, and therapies to combat the COVID-19 pandemic. And it gives direction to the FDA to identify current and potential drug supply shortages when taking into account the current pandemic. And finally, it gives funding to support maintaining the strategic national stockpile for critical medical supplies, protective equipment, and medications. In addition, the last bill that was passed a few weeks ago include a provision to allow for a tax deduction for charitable donations of up to $300, regardless of an individual itemizing their 2020 taxes or not. So that means any donation to an organization like the American Cancer Society, for folks who normally would take a standard deduction on their taxes, they weren't realizing any tax benefit for making a charitable donation. Now for 2020, currently if you make a $300 or less donation, you will receive a tax benefit. Can you all hear me okay?
Yeah, definitely. Thank you so much for sharing that,
Okay.
Eric. It's really important.
And then just a couple of other things I want to let everybody else know about. There is a fourth bill that is in the works, and currently at fightcancer.org you'll find an action alert that I want to urge all of you to complete. We are asking Congress to have a special enrollment period into the individual market insurance through healthcare.gov. In Colorado, because we have our own health exchange, the state has already lengthened the enrollment period for individual plans until the end of April, but many states simply use the federal exchange at healthcare.gov. So we want to make sure that everybody has access to insurance, especially at this time. And then also in Colorado, we have a restart date of May 18th for the second half of the Colorado legislative session. We're anticipating a lot of our work will be to ensure we protect any state-funded programs to prevent and treat cancer, things like the Colorado Quit Line to help people quit smoking, and the breast and cervical cancer programs. So that will probably be our focus, is protecting those programs when the legislature gets back to business. And then my last request is going to be for your support. In addition to the action alert, a financial gift will ensure our work with local, state, and federal government does not stop. And we will still work to ensure the cancer community's voice is heard. All of the information that I talked about, the action alert, any information about how ACSCAN has responded, or donations can all be made at fightcancer.org.
And then there's also, like, if people are interested in being a member of CAN and getting action alerts, if they haven't done that already, we are going to share the membership link in our follow-up email tomorrow with the recording.
Right.
Does anybody have any questions for Eric at this point? You can type them in the chat box. For Kelly, so I know Kelly has to sign off around in the next 6 minutes. I am going to go on to present, so this is Jen speaking. I am going to go on to present some of the resources that we've created to help support cancer patients, and then move into our question and answer. Margaret says, wondering about the 4 ways to volunteer during the shutdown. We're going to cover that too, Margaret. That's one of our last slides. I don't see anybody typing anything in the chat box. I think the work that CAN has been doing has been really impressive, Eric. And I really thank you for all the work that I know you're personally putting in with your volunteers here in Colorado. It's really important, especially now. Do you have any additional things that you would want to share with everyone?
I mean, that's it for now. I think as we get closer to that May 18th date of the Colorado legislature coming back into session, we will definitely be looking at keeping some of our bills that we thought had really great momentum the first half of the session, keeping them relevant and making sure that our lawmakers know that this crisis doesn't mean that we need to stop thinking about chronic conditions through 2020.
Okay. Yeah, and I'll be sure to keep our volunteers aware of like how they can learn more about that because it is like critical to the work that we do. Thank you so much for that presentation. And not seeing any more questions for Kelly Moran, our Executive Director, I think we'll move on to the next slide, Val. All right, so I wanted to talk a little bit about how our organization goes into a little bit more detail about how we are working to reduce isolation for our cancer patients, knowing that they, some of them, you know, it's just hard right now, and especially if you don't have friends or family that are in or close by. I did see Dan, he had a question about our volunteers who, I mean, our patients in their cancer treatments. I know that a lot of patients have been canceling their appointments prior to us shutting it down, wanting more to go with somebody that they knew and trusted if they had family and friends that were living with them. But for the ones who don't have those resources, is definitely like a concern of mine. I will say I have been working with a couple of cancer centers who have expressed interest in learning how they can provide transportation. So per the Safe Harbor Transportation Act from 2017, health centers can provide transportation for cancer patients and other people with key medical needs. So I know that some of the cancer centers have been looking into that. And we are also actively sharing with them resources that they might be available to them. So like as an example, Medicaid is still functioning. Public transportation is still functioning. I think it's really that niche of people who don't fall within those parameters that there's like some concern about how they're getting to their treatments. But what we are doing to reduce isolation is like through our 1-800 phone number, which is available 24/7. We're starting to do face-to-face discussions in a time of social distancing. So enabling if people have a smartphone or a laptop or an iPad with a camera on it, they're able to dial in and talk face-to-face with the people at our cancer center. And that I wanted to share 80% of our calls in March were COVID-related calls, and just identify the cost that goes into that. So for our callers, we can serve about 2,000 callers with information and support, and that cost us about $50,000 to do. To help offset the compounded feelings of isolation of those facing cancer, the Society has now added this video conferencing to ensure patients and families are not only getting the answers they need, but the face-to-face discussion. Last year, we served 1,738 Coloradans with information and resource coordination. 1.4 million people were served via phone or online chat in 2019, and it cost us about $50,000 to provide that. Patient navigators in Colorado, we have 2 patient navigators at the University of Colorado Anschutz Center, and SCL Lutheran Cancer Center, who have served 736 patients in 2019. The role of the patient navigator includes connecting patients to information, resources, and support systems, assisting with interaction between healthcare providers, streamlining appointments and paperwork, helping patients identify and access financial services, helping patients arrive at scheduled appointments on time and prepared, identifying appropriate social services, and tracking interventions and outcomes. Beginning in March of 2020, our navigators were transitioned to a fully remote workforce and equipped with new technologies to minimize disruption of care, including the ability to access resources and secure highly sensitive patient information while adhering to the HIPAA and privacy guidelines. They will continue to serve as remote workers for their safety and the safety of our patients until the risk subsides. We continue to provide breast cancer patient support through phone voice Reach to Recovery program, which connects breast cancer patients with trained breast cancer survivors so that they may share their experiences. We have also enhanced our ability to provide wigs while limiting social interaction through implementing a coupon and mail ordering program. And then in the future, I'll also show you guys some snapshots of cancer.org where we have an FAQ for patients who'd like to do research on their own or a live chat with someone on NCIC. Val, can we go to the next slide? Here I wanted to cover, I have talked to some of you in the emails about the information that we're providing for cancer patients. One is through our podcast. So ACS Theory Lab has podcasts, and we've been doing this for a while, but more recently those conversations that average about 40 minutes or so have really been focused around COVID. So an example would be how a deeper understanding of RNA is crucial to fighting cancer and COVID. And they'll spend about 40 minutes talking about that. And so if you have an interest in something like that, I think it would be something that would be valuable for you to check out. And you can listen to that on your computer or your iPad or your phone through your podcast application. Val, can we move to the next slide? Because I have like a snapshot of what that looks like. I'm not able to see it, but has it moved for other people?
Yes, we've got it.
Okay.
We've got your screenshot.
All right. So this is kind of what it looks like. It's really easy to use. The most recent one is talking about tobacco use in COVID. So very relevant information, I think. And then we have, if you don't have that much time to invest but are interested in what the American Cancer Society is saying, Dr. Len is also hosting on YouTube like quick snippets, and these average anywhere from like 2 to 4 minutes. And they're just quick topics, you know, addressing concerns for cancer patients, talking about masks and well-being. I've found these quick YouTube interviews to be helpful, and they pop up every, you know, couple of days or so. Val, can we go to the next slide? We should be seeing, okay, thank you. So this is a picture of one of our Hope Lodges. Kelly touched on this a little bit in her presentation, how we are utilizing our Hope Lodges to care for the people on our healthcare workers on the front line. So like there's several reasons that they might need to use the Hope Lodge. And so we're doing this in partnership with our healthcare providers. So we're working out what that looks like and who stays there. But it has forced us to make this decision of, suspending the Hope Lodge program. And this is kind of our response to that. And so as many of you know, information is changing and things are changing so quickly in our environment. Like some things are changing really quickly, I should say. So right now, as we're having these conversations with our health systems about utilizing the Hope Lodge in these different areas. So in the North region, we have one in Salt Lake City. That's the closest one to us. Across the United States, we have 34 Hope Lodges, and so potentially over 1,000 rooms that can be made available. And right now, as of Friday, we have 310 rooms that we're using at 11 Hope Lodges. And then we have 4 Hope Lodges in communities that are in talks with hospital partners. And then we have another 8 Hope Lodges that are on track to open their doors. And so I'm going to go ahead and share tomorrow in our follow-up email. I'll also share an article about that. Applied Radiation Oncology highlighted this work for us. And so now we can move on to the next slide, where we're going to talk a little bit about ways that you can volunteer while staying at home. So there are simple ways. One is following us on social media and being aware of updates as they come. So we have 3 platforms that we're using here in the state of Colorado, Facebook, Twitter, and Instagram. So if you're currently utilizing any of those social media platforms, that would be a good way to get current updates. That's also where we'll be recognizing National Volunteer Appreciation Week. That's where Lisa will be posting videos from staff. So a video that I created will be posted on there. And it's really easy. So if you're already on that platform, it's really easy to share from those pages to your community, what we're doing and how they can support our organization. And then the number 2 point is that I will be in my follow-up email tomorrow. I'll also include some pictures that you can post to your social media. They're really cute JPEGs. I used one in the email that I sent as a reminder yesterday to you. And so those will be really easy to upload to your social media platforms. Or even if you're on nextdoor.com, I think that's a good place to share the work of the American Cancer Society as well, or any other thing that is important to you. And then 3 is becoming a member of ACS CAN. So that's our Cancer Action Network, and that's our sister nonprofit where Eric was just talking about the work that they're doing. And so they are a separate organization from us because they provide, they're able to advocate with the government for different laws to be put in place where we're not able to do that as a nonprofit CO3. And then number 4 is to share a story with me on how ACS has supported a cancer patient you know, or the impact that ACS and volunteering has made on you personally. And now we can go to the next slide. So I wanted to share this information with you. Allie Bain, she wasn't able to be with us on this call, but I also wanted to share how we are collaborating with other nonprofits, and this is a pretty large way that we collaborate to help our work move forward. here in the state of Colorado is a collaboration with the Colorado Cancer Coalition. So Eric is a member, I'm a member, our hospital staff are members, and Allie is a primary care manager. So she works with local clinics. And so we all volunteer with the coalition, and we sit on different task forces, and we do different volunteer things depending on our line of work. So Allie is currently, she just got nominated to be the vice president of the coalition. So that's a really great title. And she just got that, we've been going through Stay in Place. It was announced, so it was definitely a highlight for us. And so she wanted me to share with you guys that the American Cancer Society, in our partnership, that this is a statewide network dedicated to improving Colorado lives touched by cancer, and that we have a website to support cancer patients and healthcare professionals in Colorado that is specific to COVID, and it's highlighted on the slide there. The site provides coronavirus information, virtual support group resources, meal and transportation assistance, mindfulness resources, and emergency financial assistance information. This webpage is updated daily with new local and national resources available to support cancer patients, survivors, and caregivers during this difficult time. The new site also has resources for oncology health professionals. The website and collaborative work has been recognized nationally by the Commission on Cancer, an accrediting organization for cancer centers, as well as highlighted by Denver 7 last week. We encourage you to utilize the information, share the website information with those who may be looking for resources and with those who are working with patients. And if you know of resources that are not currently included in the website, there is a form on their website. It's a Google Sheet that you can add that resource. Or you can email me the resource and I can add it for you. But if we decide to have another call in a couple of weeks, Allie will join us and talk a little bit more about like the work that she's doing and the work that we do as an organization in collaboration with them as a whole. And so I think that brings us to our next slide. And we are on time, which I'm pretty impressed with that. So at this time, I would like to open it up for questions. If you, according to Adobe Connect, and we've been having some technology challenges this morning, but you should be able to press *1, so the little asterisk on your phone, *1 to come off mute and ask a question, or type it in the chat box.
So Jen, Dan had asked a question about where we're at with funds from the cattle barons fall.
Yes. Bill, do you want to give him more? Bill is managing our grants program, Dan. And so do you want to give an update on that? Because I know you have the most current information.
So we do have two agreements out for two health systems, the two major systems in northern Colorado, that we're just waiting on their legal teams are reviewing and putting the final stages in. We're aiming for a May 1st start date with those, and that was at the request of the health systems. They felt that they'd have the bandwidth because the COVID challenges and just they've got staff working from home, et cetera, they felt that they could take on those opportunities and using those funds with a May 1st start date. So that's what we're aiming for, is that May 1st start.
Thanks, Bill. And that would have been UC Health and Banner Health.
Correct. Yep.
I saw Dan
Yeah, we're
typing,
excited
so
to,
I thought that
yeah.
might be a
Yeah, he just said
question.
that's great. No, he said that's
Okay.
great. Glad to see those funds are being utilized in this fashion, and we're excited too. It's like that for those guys to have access to it and help support transportation needs of patients. It's going to be great.
Yeah. And so for the people on the call who might be unfamiliar with that, the Cattle Barons Ball is an event that's thrown up in northern Colorado annually. And this past year they chose to put the money that they raised in their paddle, they had a paddle race. The money they raised about $150,000, and they chose to have that funding go towards our Road to Recovery program. And that's being distributed through grants. I have lost access to the chat box, so
There's nothing yet.
are there any additional questions? Okay. I'm going to give us some time because I do realize kind of shared a lot of information. And I know that there might be questions that come up for our volunteers in the weeks to come. And so I want to really encourage everyone to email or call me, as those questions come up. I'm available. Currently keeping a traditional work schedule, like Monday through Friday. Like Kelly noted, I am working from home. Let's see, we have a lot of people that also called in. I know they're on a 970, but they can also push *1 if they have questions that they want to ask. And then Margaret, did I answer the questions that you had in regards to ways that we can volunteer from home? Really appreciate everyone joining us today. I think it's important to, stay connected in this period of time. Just nutty times right now. And so I just want to ensure that, I'm doing everything I can to communicate with you guys in an effective way and be here as a resource and a friend. I mean, we've gotten to know each other over the years.
So Jen, there's a comment from Dan.
Uh-huh.
So in the follow-up email that you're sending, if you could send more of the information or have Eric recap about the $300 donation, so that could be communicated with people's financial advisors.
Yes, we can do that. Thanks, Dan.
Thank you.
Did Margaret?
She answered that yes, it would. Yes, thanks.
Okay. Weird. My music just jumped to 42. Well, not seeing any additional questions at this time. I will, again, thank everybody for being on the call with us. Thank you for your continued support. I just really wanted to ensure that you guys were aware of all the things that we are doing. I've been really impressed by the work our organization has been doing in this response. In my follow-up email, I'll also include a few flyers We are updating our information pretty consistently. Even this presentation I shared with you today, I was making updates yesterday based on things that were shared with us Friday. So it is ever evolving, and I also am going to ask if you could send me an email, like maybe in response to this meeting invite, letting me know if you found the call valuable, if you want us to host another one, and like what would be helpful for you to have, covered on that call. Again, we are considering doing something on May 4th around the same time, and so it would be great. It would be really helpful to have your feedback on it, because it did take a lot of time in terms of preparation for this. But again, thank you so much for joining us. I wish my camera was working, because I would, again, show you my face, and I'm really thankful for all the volunteer work that you guys do, and I just hope you have a wonderful week. Definitely follow us on social media, and I'll be in touch with you. I'll send a follow-up tomorrow. That's how long it takes us for the recording to upload to a site, so where we can share it. So I want to share it with all of our volunteers. There were several people who said that they couldn't be here because they had prior appointments and commitments. So thanks for joining us, and I hope you have a really nice day. The weather here in Denver looks sunny, so happy Monday, everybody.
You just get,
yes.
Yep. And you're getting lots of thank yous through the comments. I like stuff, so thank yous are coming in.
That's great. Yeah, I can't.
So thank you.
Thank you so much, everybody. I appreciate it. Yeah. Crazy times, we have to do what we can to support each other. And so I'm here if you ever want to talk. All right, guys, we're going to stop the recording and